Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today I'm going to talk about a rare, fatal genetic brain disorder that has emotional, physical, and psychological effects. May is Huntington's Disease Awareness Month. This topic affects me personally. When I was in medical school, my classmate's wife, a doctor herself, was diagnosed with Huntington's disease, or HD. 13 years later, she's still alive, but her symptoms have continued to progress. I'll discuss symptoms, diagnosis, treatment options, and ways you can get involved shortly. Let's get started. What is Huntington's disease? Named after American physician George Huntington, it's an inherited, progressive neurodegenerative disease that's caused by a mutation in the gene that makes the protein Huntingtin. This mutated protein then causes certain parts of the brain to die, namely the caudate, the putamen, and the cerebral cortex. This leads to physical, cognitive, and emotional symptoms, which I'll discuss shortly. Because of its slow progression, a person may live with HD 15 to 20 years after initial diagnosis. Who gets Huntington's disease? It's an autosomal dominant disease, which means that each child of a parent with HD has a 50% chance of inheriting the disease. Males and females are at equal risk. While it affects all races, people of European descent are at highest risk, affecting 3 to 7 people per 100,000. Age of onset is typically 35 to 55, but HD can present in youth, under 20, known as juvenile HD, or in older adults, known as late onset HD. In the US, nearly 30,000 people have HD, and another 200,000 people are at risk for getting it. What are the symptoms of HD? Symptoms are divided into 3 categories: physical or motor, cognitive, and emotional or psychological. Physical symptoms include involuntary jerking or writhing movements known as chorea, muscle rigidity or contractions or dystonia, unsteady gait, posture and balance, slow or unusual eye movement, and difficulty with walking, talking, and swallowing. Cognitive symptoms include difficulty focusing and organizing, lack of impulse control resulting in outbursts, lack of insight, slowness in processing thoughts, and difficulty learning new information. Emotional and psychiatric issues include personality changes, social withdrawal, feelings of irritability, apathy, or sadness, fatigue and loss of energy, and frequent thoughts of death and suicide. The most common psychiatric disorder associated with Huntington's disease is depression. Others include bipolar and obsessive-compulsive disorders. Complications of Huntington's include pneumonia and heart disease, which are the 2 leading causes of death among patients with HD. Other complications include higher rates of choking, respiratory, and gastrointestinal issues, such as pancreatic cancer, as well as suicide. How is HD diagnosed? Your doctor and healthcare team will perform a physical exam, including a focused neurological exam, order blood tests, perform neuropsychological testing, order brain imaging like CT or MRI, as well as recommend genetic counseling and testing. So how is HD treated? Unfortunately, there is currently no cure or treatment that can slow or reverse the progression of Huntington's disease. However, several medications and other interventions can help manage symptoms. Medications such as Tetrabenazine, amantadine, haloperidol, and flufenazine can suppress unusual movements. Haloperidol and tetrabenazine are also used to treat hallucinations and delusional thoughts. Because depression and suicide are common among individuals with HD, antidepressants such as Celexa, Zoloft, anxiolytics, and mood stabilizing medications such as Lexapro and Depakote can be prescribed. A multidisciplinary team consisting of a neurologist, psychologist, psychiatrist, nurse, social worker, and physical and occupational therapists all work together to provide comprehensive care. Social and community support is very important in HD care. Caregivers, including spouses and children, may also need support when dealing with the challenges and stressors of caring for a loved one with Huntington's disease. So how can you get involved? You can donate to, volunteer with, and learn more from the Huntington's Disease Society of America, or HDSA, the Huntington Society of Canada, the National Institute of Neurological Disorders and Stroke, or NINS, and the Huntington's Outreach Project for Education at Stanford, or HOPES. Well, that's all for today, and here's your joke of the day to start your weekend right. What did the paper say to the pencil? Right on! I'll see you on Monday, 3 p.m. Eastern. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.